Good morning, dear friends, students. Today's topic is suture materials and needles. The ideal suture material, if any topics, if you take, if in that topic, if it is mentioning ideal, then there is no ideal material or ideal procedure is not available. So, choice of suture material depends on patient's condition, type of incision, and the strength and the reaction of the suture. Hence, ideal suture material should have good tensile strength, excellent knot security, inertness, easy handling, smooth passage through tissue, predictable absorbability, flexibility, resistance to infection. So if you take all those ideal suture material, there is nothing like ideal suture material. Now, suture size. Sized according to diameter with 0 as a reference size. Numbers alone indicate progressively larger sutures. Number followed by a 0 indicate progressively smaller suture like 20, 40, 50. So 50 is the thinner material. The thickness size is very small. Classification of sutures: absorbable, non-absorbable, natural, synthetic, monofilament and multifilament. So to start with monofilament sutures. Grossly appears as a single strand of suture material. All fibers run in parallel. Minimal tissue trauma or resistance harboring microorganism and it ties smoothly, requires more knots than multifilament sutures because it is slippery. Possess memory. Examples are monofilament, synthetic and non-synthetic. Synthetic like monocryl PDS and absorbable synthetic like monocryl and PDS. Non-absorbable synthetic like example Prolene nylon. So multifilament sutures. Fibers are twisted or braided together. So please note either it is twisted or braided and it has greater resistance in tissue, provide good handling and ease of tying, fewer knots required because of the braided, it will not slippery. Examples are vicryl or silk. So types of suture material, example monofilament, absorbable are catgut, again plain or chromic, polydioxone and monocryl. Non-absorbable like polyamide, polypropamide, polyester and stainless steel. Multifilament examples are absorbable like vicryl, rapid vicryl, polyglycolic acid. Non-absorbable like surgical silk, cotton, polyamide braided, polyester braided. Principles of suture selection. So if you want slow healing tissues, you have to apply over the slowly healing tissues. Example, skin, fascia and tendon. It's better to use non-absorbable suture material. If you want rapid healing tissue, example mucosal wounds like lips, buccal mucosa, better to use absorbable sutures. Monofilament sutures preferably in potentially contaminated tissue. Multifilament sutures are more likely to harbor contaminants. So in those areas, polypropylene or polyamide is preferred. When cosmetic results are important, use smallest inert monofilament. Avoid skin sutures and close subcuticular whenever possible. Example, face. Nutritional status is another thing. When a patient is undernutrition or undernourished, hypoproteinemia, anemia, jaundice, diabetes, non-absorbable sutures should be used as tissue need to be kept in approximation for a long period. So if you take absorbable suture material in a malnourished or hypoproteinemic, jaundice, diabetic, anemic patients, the wound healing it will take time, so wound dehiscence can occur. Examples, we are not using in surgical center 10-0, but it is used in a case of vasovasectomy and after tubectomy, so that is called tuboplasty. 3-0 subcutaneous fat, and in esophagus surgery 2030 again ovarian surgery, peritoneum, closure of peritoneum, small bowel anastomosis, end-to-end anastomosis or end-to-side small bowel or large bowel surgeries. 2-0 size again you can use in stomach and urinary bladder surgeries. Kidney 1-0 is for kidney, 1-0 or number 1 for muscle, anterior rectus sheath, linea alba or hernia repair. Hernia repair is the incision hernia or abdominal wall hernia, not the inguinal hernia. In inguinal hernia, number 1 we are not using. 1-0 yes we can use. Suture characteristic like absorbable sutures. So take natural one, so degraded by, so again the natural product of the absorbable suture that is degraded by proteolytic enzymes. So the mechanism of disappearing or absorption is by proteolytic enzymes in absorbable naturally suture material like chromic catgut or plain catgut. So this is that collagen. This is prepared from the collagen of submucosa of sheep intestine or the cirrhosis of beef intestine, and the tensile strength maintained for 7 to 10 days, and the complete absorption is within 70 days. So the side effects are marked tissue reactions are there because of the natural product, and they allergic to that or body will react to that. So you can use in a case of repairing rapidly healing tissue that require minimal support, ligating superficial blood vessel or subcutaneous blood vessel, suturing subcutaneous fatty tissue in case of circumcision, and suturing of the mucosal surface. Synthetic absorbable suture material, this is synthetic, that is stronger, long lasting, more dependable and predictable rate of absorption, minimal tissue reaction, and here the absorption is by hydrolysis. Synthetic is absorbed by hydrolysis, natural is by proteolytic reaction. So example is polyclactin 910. So it's a braided multifilament suture, and the color is violet color. That is because it is made up of the co-molecule. It is made up of lactic acid and glycolic acid. Thus, the tensile strength is increased approximately 65% at 14 days, and it disappears. The tensile strength loses in 28 days. And absorption it will take minimum 40 days or complete by 70 days. And here the increased tendency of knot to slip, additional knot is required. So minimum 3 to 4 or 5 knots is required. So because of the synthetic quality and the minimal tissue reaction is there. And the Vicryl, the Vicryl is the company name, it's a violet color, that is because of the coated with the calcium stearate. So it permits easy tissue passage, precise knot placement, and tying of the knot is easy. Its use is in the presence of infection. Yes, it is coated. Polyglactin is available, antibiotic coated. So in the presence of infection, yes. In general, soft tissue approximation or vessel ligation can be used. So polyglycolic acid is similar suture material. The copolymer of glycolic acid coated with the polycaprolate has a similar tensile strength or absorption profile. Another one is the uncoated one. That is, the company name is or happy. It is white. It's not violet in color. It's white in color because it is not coated, and its exposure of coated vehicle to gamma radiation. So it's low molecular weight. It differs from the polyglactin. In initial tensile strength is 30%, that is 40%. 70% of tensile strength lost in 7 days, and absorption begins in 7 to 10 days, complete by 42 days. That coated one is violet color, that is complete by 70 days. Here it's used in skin suture, oral mucosa, vaginal mucosa, or perfusion. Example circumcision. Polyglycopropyl. So again, it's a monofilament. It's a synthetic copolymer of glycolic and E-caprolactone. A superior pliability leading to ease in handling and tying the knots. Tensile strength is 60% up to 7 days, and tensile strength lost at 21 days. And the complete absorption it will take 120 days. Usage: subcuticular suture, soft tissue approximation, and ligation. Polydioxone, again synthetic one, absorbable monofilament suture made of polydioxone. Extend wound support, elicit only a slight tissue reaction, and 70% tensile strength at 14 days, 25 at 42 days. So absorption completed up to 6 to 7 months. So low affinity for microorganism. So soft tissue approximation, especially in pediatric, cardiovascular, gynecological, or ophthalmic. Again, it can be used for suturing the rectus sheet in a case of laparotomy. So these are the colors. The rapid or uncoated polyglactin is white, and the coated polyglactin is violet in color. PDS, two colors are available. One is green and another one is blue. So the typical use of polyglactin: skin, perineum, oral, or laceration. The PDS polydioxone is used in an emergency case traumatology, and the ligaments, you can suture the ligaments, fascia, and the rectus sheet. Non-absorbable sutures, natural, is surgical side. It is braided, made from silk cocoon, silk spun by silkworms, coated with beeswax or silicone. So the advantage is standard of performance is superior handling characteristic. Tensile strength, again the surgical silk is absorbed or undetected in the wound site by 2 years. So though it is non-absorbable, but it is undetected in the wound by 2 years. So it is absorbable in other way. The problem is it cannot be used in acute inflammatory reaction can occur because the silk is a natural or protein or hypersensitivity to that protein. So triggered by this material. Host reaction, encapsulation by fibrous connective tissue leading to foreign body granuloma like swelling or sinus formation. Surgical cotton. Nowadays we are not using cotton suture material, rarely used nowadays. And the other one is silk is braided. but cotton is twisted. And the long staple cotton fibers, tensile strength is up to 6 months. Complete absorption is not absorbable. So weakest of the non-absorbable suture, and it becomes encapsulated within body tissue like the silk. Synthetic polyamide, that is also called nylon. So available is a core monofilament. Tensile strength is 25% lost by 1 year. So handling knot insecurity is lower because minimum 4 to 5 knots you have to put because of the slippery minimal tissue reaction. Another one is non-absorbable synthetic suture material, polyester fiber. So formed from polyester, polymer of polyethylene, multifilament braided. It's a braided on, coated with polybutylate. So coating, that advantage is decreased friction for ease of tissue passage and increased suture pliability. Minimal tissue reaction, lasts indefinitely in the body, stronger than natural fiber, and usages are vessel anastomosis, placement of prosthetic materials. Polypropylene, so this is in blue color, also called Prolene. Prolene is the company name. Polypropylene is a blue color monofilament, and this suture material suit with the ideal suture material. So because it is not adhere to the tissue, it can be used subcuticular sutures, for example, after thyroidectomy. So useful as a pull-out suture because of the non-adherent property. So you can pull it out, or if you use the other synthetic non-absorbable material like polyester, that can adhere with the tissue material. So while you try to remove by pull it out, so the additions is not easy to remove. So that advantage is there with the polypropylene. Holds not better than other monofilament synthetic material, biologically inert, minimal tissue reaction, and a tensile strength up to 2 years. So even in contaminated and infected wood, you can use this polypropylene monofilament. And surgical steel, olden days for inguinal hernia repair, before the invention of the suture materials, fascia lata and the stainless steel they were using. And nowadays we are using this steel in modern practice also, not for the inguinal hernia. So usage is primarily in orthopedics, neurosurgical, thoracic, and after, say, for example, bypass surgery, CABG. So for approximating the sternum, so closure of the sternum, abdomen wall closure, rarely we are using. So it is monofilament, and a twisted multifilament also is available. Can be made with the flexibility, fine size, and the absence of toxic element. High tensile strength with a little loss of time. Low tissue reactivity, holds not well. You have to twist it. There you cannot put a knot over the stainless steel. Handling is very poor. Can tear gloves or tear out of the tissue. So handling is a little bit difficult. Now we will come to the needles, surgical needles. So two types, eyed on, eyeless. So eyed needle with eye means you have to thread the needle with either cotton, the olden days cotton, or silk or nylon. But eyeless means it's already with the needle, so there is no eye. So types are round body. Round body means the figure itself you can see is a circle, and throughout the needle it is circular, and that they used to suture soft tissue excluding skin, because skin is a tough tissue. You cannot penetrate. This round body is not that easy to penetrate the skin, but you can use GI tract, muscle, fascia, peritoneum, even subcutaneous. Even you can use the suture material, that round body for closing the rector sheet. But it is tough to close because the circular body or round body needle is not that easy. Instead, you can use a cutting needle. So cutting needle two types. The triangle here, you can see the apex of the triangle is towards above. So the posterior aspect or the convex aspect is flat and the concave surface is pointed on. So this is a conventional cutting needle. So sharp edge towards the inner circumference used to suture the skin or tough tissue like the sheet also you can use. The reverse cutting, as I said, the apex is towards the down and the flat surface is towards the upper one side. So triangular body, sharp edge towards outer circumference. This improves strength and resistance to bending. So in tough tissues, if you take a suture, for example, if you suture the round body needle for closing the suture, it can bend. So that's an ideal example. So here the reverse cutting, the advantage is it improves the strength of the needle and the resistance to bending. Another one is taper cut needle. Taper cut means to start with cutting and in the proximal two-thirds it become round. So combines initial penetration of the reverse cutting needle with the minimized trauma of a round body needle used for cardiovascular. So initially cutting, later on round body. So these are the variety of needles. Nowadays we are not using the for example laparoscopic procedure, the J-shaped needle they have mentioned. Conventionally we are not using that kind of J-shaped needle. Instead we are using half circle needle and the proximal portion, that's towards the thread, we straighten it. So in that way we can introduce 30 mm needle into through the port, 10 mm port you can introduce, and inside you can put a endo suturing. Okay, thank you.